The Pacific Islander Diabetes Prevention Program, PI-DPP, is a year-long evidence-based lifestyle change program recognized and supported by the Center for Disease Control and Prevention, the CDC. PI-DPP was formed through a partnership between the Association of Asian Pacific Community Health Organizations and the Pacific Islander Center for Primary Care Excellence, as a project funded by the CDC DP-17-1705 grant to scale the CDC national DPP in underserved areas. Currently, PI-DPP consists of 11 sites throughout the U.S. and U.S.-affiliated Pacific Islands. Aligning with DPP success standards, participants aim for 5% body weight loss, 150 weekly physical activity minutes, and lower HbA1c values. Listen in each week as we highlight PI-DPP sites. Mililani Leui, Program Manager of PI-DPP, sits down with site representatives to hear about their community stories and program impacts. This week, we spoke with John Calep of the Arkansas Coalition of Marshallese, ACOM. ACOM is an organization based in Springdale, Arkansas, which aims to empower the Marshallese community through culturally sensitive programs via education, leadership, and policy advocacy. In this episode, Mililani and John speak about the importance of bringing together the Marshallese community in the United States, as well as innovative and culturally reflective retention strategies.
My name is John Calep, and I'm a lifestyle coach. I work for ACOM, and I'm a coordinator for the food pantry. And especially, I'm a PI-DPP lifestyle coach, and I've been doing this for almost 5 years.
My name is Mililani Leui. I'm the program manager for the Pacific Islander Diabetes Prevention Program.
So the first question is, why is a program like this important for the community you serve?
It's important because diabetes is prevalent in our community. And in fact, 30 to 50% of our adults have diabetes, and many more don't know they are at risk for diabetes. We want our community to be healthy. We want to beat diabetes. Our team goes for our communities to delay or prevent diabetes.
Why is it important to tailor the program to your community's specific needs?
Diabetes affects men and women, children and young adults. Most of our people don't have insurance and medication for diabetes, and it's expensive. 50% of Marshallese people are here in Arkansas. Diabetes rate in the Marshall Islands is very high, and we are the leading nation for diabetes, and we want to make changes for our community here in the U.S.
Is there any background information you would like to share to reinforce the importance of this program for your community?
Yes, we screened and found that 658 were at risk for diabetes and 466 at pre-diabetes or history of gestational diabetes. It is a lot of number. We are more than 20K Marshallese citizens here in Arkansas.
What impact has your site had on the communities you serve?
For our program for PI-DPP, we do have partnership with the community clinic and public health because we're in the same building with them, and then we build partnership with them and some other organizations. In our impact report, we have 915 participants enrolled, 533 completed, 332 reduced risk of diabetes, and total site weight loss is 10,399 pounds and 4,047,921 total physical activities minute. Not only the classes that we do have activities too, which is our Zumba class. We always remind them that there will be like a Zumba class every Saturday for those that wanting to start their physical activities. This is what we try to tell them so they can join us every Saturday to start their physical activities.
What are some of your site's challenges and or best practices for recruitment, retention, and general programming?
Some of the challenges we face in recruitment, now that many people are moving to other cities outside Springdale, we want to establish our program with our sisterhood side. The best practice is we do have like Zumba class and hula class, and we have a food pantry. Like every time we have participants coming in, like we just priority them like to whatever we can keep from the food pantry, so they can keep coming every Wednesday to stay in the class. That's the best practice for like how we keep the participant stay active or stay in the class or the program. We've been doing Zumba activities for so many years. Like I joined Zumba class with Faye, and that's where we find our participant there, because like so many women want to change their diet or to change their lifestyle. We keep going with the activities, doing the Zumba every day or mostly every day. People that already change and they have good result, like they keep coming back, and our team is always like try to keep this active so that we can have this participant or new participant to join us. And it's kind of challenges for us because like your body is really tired and you want to do something else, but like because we want to keep our participants stay healthy and active, and we trying to get other people like to come and like see the result from the old participant to change their mind and come and join us. People like who loves to hula, like they want to come to work out because they want to join hula, and then we end up like sign up them to be part of this program, PPP participant. Another challenge is before we never really have class together because it was the COVID, but like people are slowly like coming, and we try to keep that class in like one place. Now people are starting to get back on track and get back on normal like schedule we always have before the COVID.
What future projects and/or goals does your site have for advancing diabetes prevention and promoting healthy lifestyles?
Since we have, I would say, sisterhood side here in Arkansas, like miles away from Springdale, this is our future project to like work with them. Another one is Marshallese. They really don't have access to get healthy food and a place that they can go for activities. Like we have over there, but mostly women come in, work out with us because they feel comfortable. And the culture is really, complicated between Marshallese, like men and women. So our future project, and we want to enclose is like if we can have wellness, so we can have schedule for different men and women for doing activities, and even like learn how to make like healthy food for our participants. This is what I'm thinking like for the future, and talk more about it and on social media, and try to have people understand what we're doing, especially the Marshallese people here in Arkansas.
We thank John from the Arkansas Coalition of Marshallese for speaking with us during this week's segment. Please stay tuned for our next site highlight.